Hello and welcome back to the MCF Pre-Retiree Academy. Now listen, I know Medicare isn't exactly what most people consider to be a thrilling topic, unless you like government acronyms and late night infomercials. But here's the thing, understanding Medicare is incredibly important, especially as you start to think about retirement planning or manage your future healthcare cost, or even helping a loved one navigate their own options on the subject. This recorded presentation is designed to simplify what can feel like an overwhelming topic. So we're going to walk through the different parts of Medicare, what they cover, what they don't, and decisions you'll need to make along the way. We'll talk about the timing of enrollment, potential penalties, supplemental coverages, and how to avoid common pitfalls that can cost you big time. So whether you're approaching age 65 or just trying to get your ducks in a row for the future, my goal is to arm you with clear, practical information so you can make smart, confident choices when the time comes. All right, let's jump in and tackle Medicare one piece at a time. So let's first start with what Medicare is, an overview, if you will. Medicare is a federal single-payer health insurance program primarily designed for people age 65 and over that was established in 1966. It's made up of four parts: Medicare Part A, B, and D, and also Part C, which is known as Medicare Advantage, which bundles all of the different parts together into a private plan. While it helps cover major health insurance costs and insures citizens 65 and older, it also covers younger people with disabilities and people with end-stage renal disease. So let's talk about the parts individually. Part A covers inpatient hospital care, skilled nursing or skilled facility care, home health, and hospice care. So anything that has to do with being in a facility more than a short-term basis, that would cover those kind of things. Part B covers doctor's visits, office-based testing services, labs and laboratory services, x-rays, and ambulance services. Also covers durable medical equipment like wheelchairs, crutches, hospital beds, those kind of things, as well as blood services and medical supplies and outpatient surgery and medical services as well. Part C pertains that if you have a private version of that, like Medicare Advantage, and there's two different types. There's ones for HMOs or health maintenance organizations. They might require you to seek care in specified networks or hospitals and specific doctors inside those programs. Or there are options for what's known as a preferred provider organization or a PPO, which allows members to obtain care from providers and outside networks at higher costs, mind you, but also private fee for service options as well. Medicare Part C is also known as Medicare Advantage. It typically bundles all of the different Medicare parts together. And then lastly, Medicare Part D. What does this cover? Well, it covers prescription drugs, medically necessary drugs that your doctor prescribes, vaccines like shingles or Tdap. Doesn't cover flu or COVID, those kind of things. Those are covered under Part B. And then also insulin and diabetes supplies, that especially those that are used at home. There are some of this that does overlap with Part B, depending on where you're at and how you're getting it administered. What Part D does not cover is over-the-counter drugs like Tylenol or Advil, vitamins, any holistic herbal kind of things. It also drugs that are not on your plan's formulary unless that is an exception that's been granted, and anything covered under Part A or B, like drugs that you use during a hospital stay, or chemotherapy clinics, or any of those things where you might be in a facility and administer those drugs, is not covered on Medicare Part D, but back under Part B. So what are some of the rules? We'll talk about a couple of things. Really, Coverage rules is any item or service. It must be reasonable and necessary for the diagnosis or treatment of an illness or injury, or to improve the function of malformed body part, a member, organ, those kind of things. And it also must not be specifically excluded on a list. So let's look at what some of the most common Medicare coverage exclusions. It's things like dental care, cosmetic surgery, personal care, private duty nursing, so private staffing of a nurse at your home is not covered. Long-term care is not covered directly. Alternative medicine, this is including experimental procedures or treatments such as acupuncture, chiropractic services, except when manipulation of the spine might be medically necessary. Also, it does not cover any care outside of the United States. Hearing aids, with the exception of certain implants for extreme hearing loss, can be covered. Eyeglasses, except for something that pertains to like cataract surgery, something medically necessary, as well as custodial care, unless skilled nursing is provided at those facilities. So basically what that means is like assisted living, it needs to have skilled nursing that is a part of it, or it won't be covered. Eligibility. So first of all, you must be a U.S. citizen or have been permanent legal resident for 5 continuous years and be at least 65 years of age or older, or under 65 and disabled and have been receiving Social Security disability insurance for at least 2 years or 24 months, receiving continued dialysis for permanent kidney failure, or in the need or on the kidney transplant list, or the final exception is if you have ALS, also known as Lou Gehrig's disease. So let's talk about Medicare Advantage and Medicare Medigap, as they call them, policies. Medicare doesn't cover all the cost that I've noted right here and above. Most people on Medicare purchase supplemental insurance, also known as a Medigap policy, which kind of fills the gaps to make it whole in terms of that. Medicare Advantage plans are the alternatives to the Medicare supplemental plans. So in other words, like I mentioned before, you can buy the Medicare Advantage plan, usually under Part C, from private companies that offer those. And then it bundles all of your Medicare supplement policies together. And then when Medicare beneficiaries selects a Medicare Advantage plan, then they no longer need any of the supplements like D or B, because it's all encompassed in one. So how Medicare Advantage works is it's a private health organization that contracts with Medicare for certain types of plans and service areas. Think of companies like Humana, Cigna, Aetna, United Healthcare. Those are the main ones that are offered, especially in this part of the country. The plan type includes both HMO and PPO services, as I mentioned before, and Medicare savings accounts and special needs plans are available inside those Medicare Advantage plans. So how Medicare Advantage works, it must cover everything that the original Medicare covers, and starting way back in 2006 and in general, must also offer the Part D benefits as well. So it will cover A, B, and D in general. Plans are allowed to enhance benefits beyond their original Medicare. However, premium increases are part of that. So if you expand your coverage, premium increases become part of that, or increases in cost sharing, and they can only occur after approval from the Centers for Medicare and Medicaid in advance, and they have to give notice to enrollees of that if any of those plans change. So what you should consider when you're deciding to enroll in Part A, which is the hospital insurance. Most people don't pay for Part A, by the way, and you can no longer contribute to a health savings account if you enroll in this and have Medicare. You can use your health savings accounts for things like co-pays and those kind of things. But if you decide to delay enrolling in Medicare, make sure to stop contributing to your HSA for at least 6 months before you plan to enroll in Medicare. When you enroll in a premium-free Part A, you get up to 6 months of retroactive coverage, so up to the month you were first eligible. And if you don't stop your HSA contributions at least 6 months before enrollment, then you might have to pay tax on the HSA contributions that you had. You're not eligible for marketplace premium tax credits and cost sharing reductions that lower your marketplace plan deductible, copayment, and coinsurance when you qualify for premium free Part A. And if you have to buy Part A and you don't buy it when you're first eligible, so in other words, when you turn 65, your monthly premium may go up 10% for every 12 months you didn't have coverage. You'll have to pay the higher premium for twice the number of years that you could have been on Part A if you didn't sign up. So here's the deal. You can sign up without enrolling into Medicare 65. If you have insurance, you continue to work past age 65, then that's fine. But you do need to sign up. You just don't have to take the coverage at that point in time. So what should you do when you're considering to enroll in Part B, or, the medical insurance portion of it? Most people pay a monthly premium for Part B, or at least that way. It's usually deducted monthly from the Social Security and or Railroad Retirement Board if you're on the Railroad Retirement System. Not as many people in that anymore. And if you are getting Social Security, already getting your benefits, there are 4 ways to pay your premium. If you're already taking that and don't get that set up front, you can pay it online, credit or debit card, pay directly from a savings or checking account. You can sign up for what's called Medicare Easy Pay or mail your payment directly into Medicare. You don't have to roll in Part B, but if you get it later, then you may have to pay a lifetime late enrollment penalty, which is added to your monthly premium. People who don't get a retirement payment from Social Security, or whose payment isn't enough to cover the premium, get a bill from Medicare Part B premiums. The bill can be paid again, just like the ones above. If you have VA medical insurance, those are separate from Medicare. With VA benefits, you may choose to not enroll into Part B, but you pay a penalty if you don't sign up for it. So again, you need to sign up. You just don't have to enroll on that. And if you do have Veterans Administration health insurance, I would definitely visit va.gov to make sure you understand about the special enrollment period for that. So when must you enroll in Medicare B? If you want to buy a Medicare supplement like the Medigap policy, you must have Part A and Part B. If you want to join Medicare Advantage plan, you must have Part A and Part B. If you're eligible for TRICARE, this allows for expanded medical coverage. You have to be at least 65 or older. Add family members or survivors to that as well. Okay, so enrolling in Medicare, there is an automatic enrollment feature. So if you're already getting Social Security or your railroad benefits for at least 4 months before you turn 65, then you will be automatically enrolled into Medicare. So if you take it before 65, your Social Security benefit, you'll automatically enroll in that at age 65. You'll get your enrollment package in the mail along with your Medicare card about 3 months before you turn 65, and your coverage begins on the first day of the month that you turn 65. You also may qualify for Medicare based on a disability. You must be entitled to, if you are getting Medicare disability policy, you must already be enrolled in the Social Security disability insurance for at least 2 years. On the 25th of the month, you're automatically enrolled in Part A and B once you've achieved that. And if you have ALS, also known as Lou Gehrig's, there is no waiting period. You'll get a special Medicare notice when you turn 65. So starting in January 2020, the marketplace started using a new special notice that Medicare sends a few months before you or someone else on your application turns 65. And the purpose of the notice is to inform you that you'll soon turn 65 and you may be eligible for Medicare, and you can change your healthcare coverage. It doesn't mean you have to. There are two different ways to enroll. There are Medicare enrollment periods and late enrollment penalties if you do not sign up for it when you're first eligible. So even if you're going to keep your health insurance through your work, go on and sign up for the benefit, but you do not have to enroll. I can't say that enough. You can keep your employer or marketplace plan, and then after Medicare coverage starts, including you can keep your marketplace plan after your coverage starts and you sign up for it, even if you're not enrolled. You can gain access to information in other languages and in accessible formats, as well as Braille and audio at no cost to you. You can go to marketplace.cms.gov on there and follow that link, and it will take you to the forms that you need. So on the screen here, I'm going to leave it up for a second. We have several online resources that you can use when it comes to Medicare. There's a lot to consider on it. If there's anything that you have questions on, I would encourage you to go to the Medicare.gov website. There's also within there an understanding the prescription drug component of it. Part D gets more detail about what's covered, and then understand the difference between Medicare individual supplements by themselves and Medicare Advantage. I do see more people going to the Advantage plans, and you got to pay for your supplemental policies anyways, and keeping that all encompassed under one umbrella seems to be a little bit easier. And I would say that the rates are set, other than if you get some expanded coverage. The rates are set, so it really, being from company to company really doesn't, there's not a whole lot of advantage from what I can find or have seen from one company's plan on Medicare Advantage to the other. Also, I didn't have a chance to create some new slides, but I did get a couple of questions from a participant in regard to Medicare, and specifically something that's known as credible coverage and forms that may be sent to you. So what is Medicare credible coverage? So this refers to health insurance coverage that is expected to pay on average at least as much as Medicare's standard prescription drug coverage, or Part D. It's most commonly used in reference to prescription drugs plans, but it can apply to other types of coverage too. So here's why Medicare credible coverage matters. If you have a policy that has credible coverage, when you become eligible for Medicare, you can delay enrolling in Medicare Part D, that plan, without facing a late enrollment penalty. So if you have a plan that has credible coverage, and you wait to enroll, you can wait to enroll in Medicare Part D without a late enrollment penalty. But if your drug coverage isn't credible, you delay enrolling enrolling in Part D, you may have to pay a penalty for life once you enroll. It's basically an increase that stays that way. So what are some examples of credible coverage? An employer or union group health plan, including retiree plans, VA, Veteran Affairs coverage is a form of credible coverage. TRICARE, and there's several other things that cover, but those are the main three. So how do you prove it that you've had credible care? Each year, your company's insurance provider, your current insurance plan, your group plan, must send you a notice by October 15th stating whether your current coverage is credible or not. And I know when you get that letter, save it. That is your proof if Medicare ever asks. I'm sure you can contact your provider and get copies of that if you feel like you've missed it. But that letter is mailed to you each year prior to October 15th. I also had one other question on Medicare forms 1095B and 1095C, which is part of the IRS tax forms related to health insurance coverage. But they serve different purposes and come from different sources. So let's break it down. The 1095B health coverage form, this is usually sent by Medicare insurance companies or government programs like Medicaid. Its purpose, it shows that you or a family member had the minimum essential health coverage for all or part of the year, satisfying the ACA requirements. That is a form, that 1095B is sent by Medicare insurance companies or government programs like Medicaid to make sure that you satisfied your ACA requirement. If you get that letter, save that as well. Form 1095C is an employer-provided health insurance offer and coverage. Basically, large employers send that, and that shows whether your employer offered you health insurance, what kind of coverage, and for which months. Both of those are available directly from your employer. And then lastly, I am by no means like an expert in Medicare, but I do know quite a bit. I have resources at my fingertips that can answer more specific questions. And I also have resources that are people in this space on a regular basis that I can trust and get answers to should we need it. Take advantage of those resources if you have something specific to ask in regard to Medicare or anything on this presentation. I know insurance, you can go down those rabbit holes and it gets very confusing very quickly. Try to keep it high level here. As always, plan for this. Make sure, if nothing else, and you're still working, that you go on and sign up for Medicare at age 65 or 3 months before. You don't have to enroll. You don't have to switch your coverage, but it is important you go on and do that. And then just reach out, do the planning that you need to do as part of this. You'll find your way, and I'm here as a resource to help you as always. Thanks for watching. If you have any questions, feel free to reach out to our team here at MCF. See you, everybody.